Communities affected by the ongoing flooding in northern Kenya are now facing a health crisis following the outbreak of waterborne diseases there. Public health officials say a cholera outbreak in Garissa County is threatening the lives of many residents who were already struggling day to day. CGTN's Nick Mudimba has more.
People in Garissa had for years been praying for rains. The area, like other in northern Kenya, had experienced its worst drought over the 4 decades. Just earlier this year, leaders were appealing for more food and water supplies. But after 5 failed consecutive rainy seasons, the rains came. The heavy downpours in October caused by the El Nino phenomenon have caused widespread flooding. Roads have been cut off, while homes, schools and public amenities have been flooded. Families displaced in Garissa County are still waiting for water levels to reduce in their flooded homes. In the meantime, they've been forced to seek help in camps for the displaced run by organizations like Red Cross. But health officials are warning that many lives are now at risk as waterborne diseases, including cholera, are spreading in the region.
There are a number of population that has been affected, and we need to, from the health point of view, we are also witnessing upsurge of diarrheal cases.
Many parts of Kenya have received their heaviest rainfall in recent years. The Kenyan Health Ministry is struggling to meet the needs of people in far-flung areas that have been cut off. The numbers in these IDP camps keep on ballooning every day, overstretching the social amenities, most importantly sanitation. But according to the Kenya Red Cross, more education and sensitization is needed to tell them and educate them more about the dangers of overcrowding. Kenya's Ministry of Health says that as of December 1st, there were more than 391 cases of diarrhea, almost 100 cases of cholera, and nearly 550 people are suffering from malaria.
Because these are displaced populations, they are now in a makeshift and which does not have toilets. So although mobile has been prepositioned within the IDPs, it's not adequate. So this issue of hygiene and water issue, because the water infrastructure was also destroyed, so it's complicating the issue of sanitation, and we anticipate in such scenarios to have more cases of diarrheal diseases.
In conjunction with the Garissa County Ministry of Health, we have done outreaches for nutrition and medical outreaches, whereby we have also supplied wash supplies to the IDP camps. By wash supplies, I mean water purifiers, water jerry cans, buckets.
Aid workers are struggling to assist those most in need as roads have been made impassable by the heavy rains.
Sanitation.
Our women and girls don't even have sanitary pads. We need these things. We're appealing for well-wishers to help us with these basics.
Kenya's government has set up the National El Nino Emergency and Disaster Response Center that includes a multi-agency team tasked with monitoring, flooding and warning communities that are facing severe risks of flooding. Nick Mudimba, CGTN.